My name is Becky Tim, and I'm the Executive Director for Advocates for Better Health. And I am a proud partner with the City of Minneapolis for the Public Health Community Institute. My colleague, Patrick Jones, who is our Director of Finance and Operations, and I are part of your team as you make your way through applying for the Public Health Community Institute demonstration dollars, and we are also involved with the training. Today's training is going to be about program design and mapping and program development. A little bit about myself. I have been an executive director for 15 years and worked for nonprofits most of my career. And before I came to Advocates for Better Health, I was on staff at the Powderhorn Neighborhood Association as their executive director and Nokomis East Neighborhood Association. So I'm really well aware of the excitement for the Public Health Community Institute and what we all can do together. And like you, I am also actively involved with program design, evaluation, seeking funding, grant writing, contracts, that sort of thing. My role, again, is to support you as you apply and to build that capacity for smaller Minneapolis-based organizations to do good work in our community. I'm happy to meet you by this video and to work with you. And so the idea behind my presentation, which is the second of 4, is getting your big idea from beginning to reality. So we're going to go over some concepts about program development, design, and mapping. And then we also will look at some of the materials that we have created and resources we have created for you. And then talk about the applying for the demonstration dollars. Today's agenda is introduction to these key concepts. Working on the PHCI project worksheet, which I'll go over in detail, which will be more in depth than the application you'll first fill out. But by the time you get through the process and get to approval, we will work together on completing all aspects of this worksheet for your big idea. We'll talk about additional resources, support, and then we'll wrap up and I'll give you a reminder to do your online knowledge check. We were able to do these 4 trainings in person in May, and we are offering these 4 trainings online and with the knowledge checks to check that our training is working well, that you're understanding the key concepts. The training objective for this is to increase the understanding of key concepts in program development, design, and mapping. And there is just so many good resources, so we're only going to talk about the ones that will specifically work for your big idea. And number 2, we'll build practical skills and confidence in creating and planning community-based health initiatives. And lastly, strengthen community engagement by fostering collaboration, shared learning, and inclusive planning approaches. A little bit about my organization. We are called Advocates for Better Health. We are a public health organization that works across the state. And our tagline is, we believe everyone can be in health, or an advocate for better health. And that includes you with the projects and the ideas and their community understanding. This is us tabling at a Juneteenth festival. We do a lot of good work in the community, and between Patrick and myself, we have close to 50 years of experience supporting nonprofits, working for nonprofits, being on boards. We love finance, which most people maybe are a little leery about, and we hope to make that accessible. But we hope to build your capacity so that you can have a successful PHCI project and build the skills necessary to go after future funding and future projects. So in person, we did this activity, but this is worthwhile to think about. We asked that each person introduce themselves, where they're coming from Minneapolis, and then your organization. And then in 5 words, condense your big idea into a very concise, pithy kind of way. And I use ChatGPT to come up with these 5 words, and like healthy food for every family, mental health supports without stigma, neighbors helping neighbors stay healthy. So the purpose behind this way to start the meeting is that as the creator of the big idea, as the spokesperson, as the cheerleader for your big idea, you're going to be asked in many different settings on communicating and getting other people excited. So just one way to think about it is, if you were in an elevator with somebody, what were the 5 words that would most clearly share what you're hoping to accomplish with your project? So when you're having some more free time, it might be a good exercise to think, do you know so clearly exactly what you're hoping to do with your project that you can shorten it to 5 words? So the Public Health Community Institute is a project of the City of Minneapolis. Advocates for Better Health is one of the contractors for training and to support you to get your demonstration dollars. Here is the basic outline of what the project is, and there is a website that I will put into the YouTube description for this video, but I hope that you are well acquainted with the city's website and the information. But to qualify for a demonstration dollar application, you have to be over the age of 18. You have to be a nonprofit, a for-profit, or an individual. You have to attend or participate in 6 training sessions. So we have online the 4 core trainings. This is number 2 of 4. And then April Graves, who is the program officer for the City of Minneapolis, has laid out a really great group of monthly trainings and lunches and learns. All of that and the topics, the dates, the location, and registration are available on the city's website. Once you finish your 4 core trainings and 2 additional trainings, you are qualified to apply for the PHCI application. I'll go over that in more detail. It's all online. It is meant to be a low barrier way to start the conversation with the City of Minneapolis and Advocates for Better Health. We really want to support organizations that are emerging, that are new, that don't have the infrastructure like some of the bigger organizations, so that you build that capacity in a environment that allows you to do an assessment of your current capacity and how to build on it. And then you also get to do your health project, and that you're ready to do additional grants and contracts and projects. Once you apply, you will start working with Patrick and myself at ABH. We will set up a Zoom call to meet with your team to learn more about the project that you hope to accomplish, and do an assessment of your current capacity, which will include your financial management, including bank accounts and what kind of bookkeeping program you use. And if you don't have one, that's okay. We will help you with that too. Setting that up. We'll talk about commercial insurance. We'll talk about all of the other things that you hope to build out during your time with the Public Health Community Institute and beyond that. And once we get everything agreed upon, we'll sign an agreement with ABH as the fiscal sponsor for your organization and April at the City of Minneapolis. So part of the application process will be assessment and project coaching for Patrick and myself. We'll agree upon a final project plan that meets the time limit of 6 months and a budget that fits that and what you hope to accomplish. And it really reflects the true cost. So making sure that you account for everything and that you actually take into account what we learned from some of the training was a lot of smaller nonprofits, and you might find this, you don't have enough money to pay for your time and other expenses, and we want to do a budget that really reflects that so you understand when you're going for future funding, like the true cost of putting together a plan. And then we'll talk about some capacity building goals that will happen during your time with the Public Health Community Institute, but also just general good practices for a nonprofit or an organization or individual doing this kind of work. You will get your demonstration dollars, and you can apply up to 15 grand for this project, and it will come in 3 payments. So the first payment will be 1/3, 1/3, and 1/3. So that will, the planning and the schedule for payments will be part of that. And then finally, a final report. We'd love to hear how it went. Like you, the city of Minneapolis has gotten a grant for this project with the federal CDC. And so in addition to supporting you all, we want to demonstrate that this has been a successful, useful project for the city of Minneapolis and for its residents and for its leaders like you. So we'll ask for how did it go, how to improve it, and some good stories that come from the your experience. You have seen this in the Public Health 101 training, which is the first of the core trainings. It's a public health approach. If you Google public health approach, you'll find lots and lots of good information. We've really tried to find the right language, the right framework that will fit the size and scope and purpose of your PHCI project. But you want to, when you're thinking about your application, when you're thinking about a project idea, your big idea, you want to keep this project lifespan in mind. You're probably right at the assessment level. You are a community member who's identified a health need in a community that you want to work in or a population that you want to work in. You started to design, so you're creating your program goals and strategies. What will change after your project is completed? You're looking at resources. For this one, it is PHCI funding, and there's some limitations on it that we'll get into in the budgeting, number 4, core competency. But 2 of the big things to keep in mind is through this grant, the city of Minneapolis cannot pay for food and beverages. So that's probably the biggest one that's going to impact your planning, that there'll have to be other funding resources for that kind of expense. But resources also means people, like who is on your board, who is going to do this work alongside you, who are your big cheerleaders. And I hope that you come to consider ABH, myself, Pat, and Patrick, and the city as part of your resources. And once we sign the agreement, we're going to put your plan into action. And then evaluation, that is number 3 for the core competency. That's a great training, but evaluation should be part of the application process, part of your design. It should be included in your resource and funding for that. And you want to tell a great story of what need or what opportunity you identified in the community and how your work through your project made a difference. And then lastly, sustainability. What's the plan for the next project? Because these are time-limited projects and funding-limited projects, you almost always going to identify 1, 2, 10 things that you could work on next. So the lifespan circles back and you start planning for the next project. But similar to what we just said, another way to look at project planning is a public health approach. Surveillance, that's the assessment. You're watching, you're noticing, you're looking for opportunities. The risk factor, what is causing this opportunity or what is causing poor health outcomes in your community. how are you going to intervene, and how are you going to evaluate and see if your intervention worked, and then you're going to implement it. So it goes from problem to response. Sorry about my flicking of the oops, just making sure I'm recording. Sorry, this is actually a little more challenging to do on your own. So obviously I'm not a TV personality or really trained in this, so I appreciate your patience. So when we go through the Google Document folder, which is an online folder, always accessible to you, and we strongly encourage you to share with your team, your staff, with your board members. These are just great resources that are meant to be useful for the size and the scope and the public health purpose that the PHCI projects are going to tackle. So we'll go over the social ecological model, understanding multi-level influences on health. We'll look at logic models. We'll look at SMARTY goals. There's some case studies, project mapping models, and organizational assessments. When you watch number 3, the core competency, they're going to really spend some time in the logic models, SMART goals, and social ecological models. And the reason for this is not because we just want to create extra work. These are useful goals, especially the top one for what you're going to be planning out. And so understanding the multi-level influences on health. So if you want to work on a project about air pollution in your community, mostly from a highway, there's multi-level influences on that project. And you don't have to be an expert researcher. You don't have to understand all of that. ABH and the City of Minneapolis will help you as you create your project. But just to know that anything that you likely are wanting to address, there's going to be multi-level influences. And this model helps you understand and map out and understand what you need to learn more about. The logic model is something that a number of funders that you'll go after funding in the future will require. So we want you to know what that term is and to have the resources to do that. And then the SMARTY goals are what we will include in your final agreement. They are going to be something that we co-create and that are understandable, time limited up to 6 months. And frankly, as somebody who does this for a living, SMARTY goals is a useful tool. And the organizational readiness assessment is part of the application, but part of the initial conversation with Patrick and myself. Like, we want to have an understanding of what level you're at and how do we get you to some stretch goals on that. Just a reminder that the Public Health Community Institute, the core competency trainings, which are available on this YouTube channel, Public Health 101, project planning, worksheets, evaluation, and budgeting for success. All of them are useful trainings with a bunch of other things added in to support you. And again, if none of this is very familiar, brand new to you, that's great. Apply and we are your coaches, we are your support system to get you more comfortable with this. It's supposed to be a low barrier way of participating. All of the materials that I've been talking about and will share are available at that website below, and you can also use the QR code. And one thing that I would like to share with you is when you're creating this, especially if your writing skills aren't the greatest or you're brand new, feel free to use a service like ChatGPT or AI. Like, they can save you a lot of time, a lot of struggle. I'll give you the frameworks, but like this is a new part of applying for grants and for contracts and to, in my opinion, lower the barriers of having to have a professional grant writer on staff or all of this like that have been barriers in the past. ChatGPT and similar services are very useful for that. And so just the last words of encouragement before I move on to 3 other things that I would like to show you. We are on your team. Patrick and I will be working really closely with you once you apply for your demonstration dollars. The City of Minneapolis Health Department has created a wonderful project, secured funding for this, and we can't wait to start supporting you. This is what I've just shared with you with the QR code for the website below. And if you have any problems with this or lost it, feel free to talk to April Graves. She will give you a link. All of this is available and accessible. We strongly encourage you to look at it and to share with your team. Even if you're not going to apply for the PHCI, this is a good collection of resources for public health projects at a community level. So each of the trainings, here we are at program development, has the slide deck and then all of the handouts too. The City of Minneapolis has also done a training on chronic disease and public health 101, equity 101, and I'd like to point this out. So when you're getting ready to apply for the PHCI, please use this and do your work on this in a Word document before you go and try to apply, because we don't have the capacity to keep your work. So finish your application, edit it, do everything you need to do in a Word document, and then cut and paste and put it into the application. This again is how you have to do most grants and proposals, is that they'll give you an online portal, they'll give you the questions, you'll have to cut and paste it, work on it in a different section and in a Word document, and then you can cut and paste into ChatGPT or other AI systems that you want to use. Finish, edit, polish everything in the Word document or Google Docs, and then go back. Don't ever edit in an online system because you probably won't have it saved. Now I want to share with you what I have put up here. So we've got a public health project design, a case study from the City of Minneapolis. So folks like you who have done a project, here's the slide deck, and then here's the planning project sheet. All of the other things that I've talked about are in evaluation. So we have the draft logic model, we have a stakeholder engagement plan, and a theory of change. So my project, my training really complements well with the evaluation. And then lastly, the fourth core competency training is given by Patrick Jones, and it is all about budgeting for success. The second thing I would like to share with you is this is the project planning worksheet. So during the live in-person training, we spent a half hour working on this. Again, the application is going to be less questions, less intensive, because we will get you to this point with your project and your budget and your evaluation plan. Here is, again, that link to that Google Docs that I just shared with you, and here's the QR code. The first section is thinking about your project idea, your big idea. And these are going to help you think through and get to the application project. But we want to know, what issue do you want to work on? What have you identified in that specific community of yours or the population you want to work in? Describe the concern and why does it matter? What's the issue and topic and why does that matter? And who's affected? So try to be as specific as you can. I want to work with seniors who are experiencing food insecurity. I want to work with young people to set up a soccer league that also talks about reproductive health and rights. I want to talk about my Northside community that's experiencing air pollution. I want to talk about increasing the amount of, or decreasing the amount of food that's wasted in our food system. And this is important for this population. The next one is community voice. We are assuming that you're a community leader and connected, but we want you to get clear on what group you're trying to reach. So these projects are only up to 6 months, and that's up to $15,000. So no, you're not going to be able to solve all of the public health and medical issues that are part of living in the city of Minneapolis. And that's really not intentional. We want you to be as clear and of who you want to be serving. It's not quantity, it's quality in this regard. How do you know this is important to your community? And who have you talked to? So remember, in the evaluation folder that I just showed you, there's a plan for that. There's going to be a training coming up in the summer of 2025 with the City of Minneapolis Neighborhood Community Relations Department to talk about effective engagement with certain populations. That will be helpful too. But we want to know, why is this important to your community? Who have you talked to? What have they said about it? And what does any data say? So the data part will not be part of the application. And if you're interested, the City of Minneapolis and ABH can really help with that. So if you're trying to find the number of people with diabetes in a certain community in Minneapolis, we could help with that research, or the long-term effects of ACEs, adverse childhood experiences, from experiencing homelessness. We can help with that. So again, you're not meant to be researchers. There's plenty of people on the staff at the health department that can help with that. Here are the goals and objectives. This is evaluation, and you'll learn this. Shouldn't be something that feels like a gotcha at the end that you're like, oh, I gotta evaluate. Should be a whole part of how you create your program, your project, how you know you're going to make a difference, how you collect specific data along the way. But the answer, or the question to always ask is, what do you hope will change because of this? What's your overall goal? What are your short-term and long-term goals? Again, we're funding projects up to 6 months. And if this project is ongoing, what's changed since you've added this component to it? Partners and resources, who can help you? What do you need? What are some additional people beyond your organization that you can partner with? What kind of space, materials, volunteers, funding? Like when you're doing your project and your evaluation, all of this is in, and your budget, all of this is involved. And then activities and strategies. It's a timeline, like month 1, we're going to do this. Month 2, we're going to do this. Month 3, month 4, and etc. So this is a useful way to track what you plan on doing and then how did it actually happen. We all know that things change. So we fully expect that your best plans are going to be subject to change, and that is another capacity building, is talking to your program officer. Well, we thought we were going to do this, and there was really severe weather on this day, so we've switched and we're doing this. So that's all part of the plan. There's timelines, and then measuring success, which is part of your evaluation. Potential challenges. This one's important too, and often overlooked, like what might go wrong. Mm-hmm. So if you're planning an activity, I'm going to pause. Sorry, I had my dog, and she was going to make a big, loud stink. And I'm sure you didn't want to hear that. But just think it through potential challenges. This isn't something to give you a bunch of anxiety, but like if you're planning an outdoor event as your main thing, what happens if there's bad weather, or what if there's a staff change, or things like that. So thinking about in advance what could go wrong and what's your plan B and C. Sustainability. This goes into talking about your budget, but I'm sure your projects are going to be identifying future opportunities to work on. So how do you start thinking about potential funders? How do you do grant management? How do you start applying during this session so that you could have sustained funding? That is one thing that most people don't think about, is that creating resources, creating potential funding is something that has to go right along with your projects too. It's part of making a sustainable nonprofit or business. And project budgets, again, I invite you to listen to the number 4 training on budgeting for success. And if you are brand new to this, go ahead and apply and do your best on the budget. We don't expect that it will be perfect. If you are already at that capacity level, then great. You'll get minimal support and coaching, but this program is really meant to support community members with great ideas to implement them. And then there's the evaluation plan that I've referenced several times. The last thing I would like to show you is the actual application. Now this might change because we might be changing where this lives in terms of, this is a Google Doc, but we might be changing to a different format, but the questions will remain the same. And again, remember in that folder that I showed you, you will also have to, you have access to all of these questions, and I strongly suggest that you take that, start putting it into a Word document, and start crafting that way. So here's the information, and here's the link to all of the questions. You need to attend the 4 core trainings and 2 additional trainings before you apply. And by completing the knowledge check after this and the 4 core competency, that will mark you as participating in the training, so that we know that. Here are all of the resources that you need, and then you can sign up with the City of Minneapolis if you haven't, to receive project emails. April Graves' information is here. She is the project lead for this project, and in addition to any support that Patrick and I can give you, April is your best bet. So here's section 2. We want to know about your contact and your organization, so your legal name, and that will be included in the agreement. But we also want to know your preferred name, so that we are correct in how we provide service to you. We want to know your phone, your email, and then what type of organization are you representing? Are you a nonprofit? Are you an individual? Or are you a business for profit or other? Let us know what that is. If you're an individual and you're applying, you must be 18 years or older. That's part of our project guidelines. Your organization name, its address, its email, its phone number, website and social media, and then 1 to 3 paragraphs about your mission, your general purpose, and your history. Again, if it's a little light, that's just fine. You don't have to have everything perfectly taken care of in terms of governance and management. We also want to know if your organization's budget's under 25,000, 50, 100, or 250. This is a weighted part of the application and the selection process. We do want to focus on very small organizations. That's not to say if you find yourself in higher brackets that you will be disqualified for, but there will be waiting for smaller organizations. Same thing for this one. There's going to be more weight for organizations who have never or have very limited experience in working with the City of Minneapolis, other government agencies, and funders. The less experience will get you a higher score. Again, doesn't mean that you shouldn't apply. It's just we want to be transparent in our scoring rubric. Then your name or title with the organization. And then these are all the trainings from the PHCI that you need to attend before you apply. So you can see the City of Minneapolis has been working on this since March. There are the mandatory ones or the recordings like you're listening to. And I have updated some future ones too. You have to do 4 mandatory and 2 additional training. Section 3 is your big idea. So I want to have a short title that we can start referring to your project as. Purpose, so 1 to 3 description, so a summary, so we can show off what we're funding. And then here is the geographic area that you want to be serving in. This does not mean that your business or nonprofit or even the individual has to live in the City of Minneapolis, but the project is to fund people and communities in the City of Minneapolis. So check all that apply. And again, don't check more than you're actually going to be working in. It's not a matter of quantity. It's a matter of knowing your community and what population you want to serve. Moving on to population served, checked all that supply, and then feel free to use the other, because this is not an exhaustive list, but if you want to work with people under 18 or people in recovery or active substance use or immigrants and refugees or Asian and Pacific Islanders, mark that and use the others too. Again, this isn't meant to be that you click everyone, because these projects are not at the scale. No project is that could work with all of these populations. Be really concise with who you want to work with and what communities have you already worked in and that you've talked to. That makes a big difference. And this one's weighted too in terms of underrepresented people in Minneapolis or areas of economic need. And then this goes back to the sheets that we were just talking about. Have you engaged with people intended to benefit from your project? If so, in 1 to 3 paragraphs, what are they saying about your idea? And then your project goals. Include 2 to 4 goals, like what do you hope to accomplish with the end by completing your project? How do you know if it's a success? And again, these are just general questions that will help you work through as you develop your evaluation plan. If this is something that you're familiar with and have a lot of experience, that's great. If this is brand new to you, just talk about what you want to accomplish by doing this project, and we'll get it into the right format for the final agreement. We want to know who's on your team, so include their name, role, and experience. It doesn't have to be all the resumes, a detailed thing. We'll find out more when we're working through the agreement process, but we want to see who else have you enlisted to help with this project. Project timeline, what do you hope to accomplish in 6 months? And then the general amount of how much up to 15,000 are you going to ask for? This 15,000 is not guaranteed. We will work with you to do a budget project budget that really fits the timeline and what you hope to accomplish. And it really covers all of your expenses, including the cost of commercial insurance, all of the things, so that you know the true cost of your project. And it does take a little bit more work, but I think any of us who have ever applied, we have tried to make the project not sound like it costs as much as it does. And then you just have all of these expenses that you didn't really think about. And the worst case scenario is to lose money taking on a project or a grant. So we want to share with you some of our hard-won experiences with that to make sure that you have the right amount in your budget. And frankly, you deserve it too. We're doing important work, and not asking for the full amount isn't necessarily a great strategy. Here's the project budget. If you have the capacity to do a full project budget, you can upload it here. And if you don't, you can use this template. Again, do your best. If it's not something that you're very familiar with, Patrick in particular will be of help with you to get the final project going. Section 4 is about operations and financial management. This is the initial assessment of your readiness to take on a project. So very simple things like, does your organization have a business checking account? What accounting or bookkeeping program do you use? If you don't have one, just put don't currently have one. And does your business or nonprofit have commercial general liability insurance? So you need that when you do events to make sure that your organization and you as an individual are covered and protected. It's part of risk management. So if you don't have that, don't worry. Patrick and I will help you with that too, and we'll include it into your budget. And then lastly, I always like to ask if people have questions or comments for us, because we are creating this project as you're creating this project. So we want to know in real time how we can be helpful. So again, my name is Becky Tim. I look forward to working with you as you apply for the Public Health Community Institute. With my background working for Minneapolis neighborhood organizations and living in Minneapolis for 13 years, I'm just really excited to hear what your big idea is and how we can support it. Thank you.